Ladies and gentlemen, good morning. To start with, I wish to express my satisfaction to be here today and have the opportunity to share some of my thoughts about the analysis of human movement with this community. And of course, I owe special thanks to Andrea Cereatti for this kind invitation. As first slide for this talk, I chose a painting from Charles Bartlett entitled Surf Riders, shown at the Honolulu Museum of Art. Looking at this painting, surfing looks easy, and this is somehow true. In fact, with practice, we are able to perform very demanding activities with no apparent difficulty. This also applies to human walking, which is the most common physical activity we perform, but at the same time is intrinsically risky, as effectively stated by the British paleoanthropologist John Napier. In fact, fall injuries-related episodes are a major problem. Fall rates increase with age for adults older than 44 years, and more than 10% of persons aged over 75 years experience at least one fall per year. And, of course, falls results in direct medical costs, and this is the reason behind the recent great interest in fall analysis and prevention research programs. Why do we fall? Falls are caused by a number of intrinsic and extrinsic factors, such as the presence of stairs, surfaces with a low friction, and clothing with trailing parts. To analyze falls, we could think to simulate them in the laboratory and to perform the analysis using complex instrumentations. But, unfortunately, falls are very difficult to replicate. Of course, it is possible to do better than this. For the above considerations, when analyzing falls in particular and human movement in general, the emphasis should be on the usual performance at home, work, and community settings. To perform such ecological analysis, first of all, the observation period should be sufficiently long, weeks, months. Second, the technology should not impede and/or affect the subject movement. Third, simple to use. It means no wires, long-life battery. Fourth, sensors should be self-contained. It means no other parts to be mounted in the environment. Is there any chance to find maybe not the holy grail, but an effective and convenient technological solution for these specific applications? A seminal work and an answer to this question was presented by Julian Morris in 1973 with a paper entitled Accelerometry, a technique for the measurement of the human body movements. In this paper, Morris gives indication for a new system of measurement, foreseeing that by improving the transducers, this method could be extended to the study of the movements of other parts of the body. The rightness of his statement is documented by the increasing number of studies which refers to his paper. However, the fulfillment of Julian's prophecy would not have been possible without the contribution of the technological advancements. On the left, the device manufactured by Morris in 1973, and on the right, a gear chain produced using MEMS technology, which is smaller than the mite approaching. The same technology can be used to produce accelerometers, gyroscopes, and magnetic field sensors. So we have a technological solution suitable for motor performance assessment, but if we want to use it to make a diagnosis or evaluate an outcome of a clinical intervention, we need that the final outputs satisfy validity, reliability, and cost-effectiveness criteria. When we want to describe the motion of a body, two different approaches can be pursued. The body can be treated as a material point, located in the center of mass or in different peculiar locations, such as the foot, or, according to rigid body kinematics, by means of its linear and angular positions. Within this framework, the relative movement between the femur and the tibia forming the knee joint will be described by 6 curves. However, unless using invasive technology, the linear displacements are commonly disregarded since they are too small to be measured. To estimate segment orientation, two distinct problems must be solved. First, the orientation of a local technical frame fixed with a body segment must be determined for each instant of time by attaching a measurement unit to the skin. Second, to obtain a repeatable and clinically meaningful joint kinematics description, an anatomical frame must be univocally associated to the bone. The anatomical calibration procedures allows to determine the time invariant registration between the technical and anatomical frames. Within the context of this talk, we will refer to low-cost sensor arrays composed by 3-axial accelerometers, gyroscope, and magnetometers. This common 9-axis configuration allows for the determination of the 3D unit orientation with respect to a common global frame. The vertical axis of the global frame coincides with the gravity vector. The vertical plane is defined by the gravity and the direction of the local magnetic north, and then the global frame can be determined. Curiously, it has been provided evidence very recently that turtles also use the magnetic field of their natal beach to return as adults. The unit orientation in dynamic condition is commonly estimated using sensor fusion algorithms. A non-compensated estimate of the unit orientation can be obtained by integrating the differential kinematic equation describing the relationship between the quaternion derivative and the angular velocity components. The non-compensated estimates can be then corrected using the data from the accelerometers and the magnetometers and a specific sensor fusion algorithm. Kalman filter-based algorithms are the most prevalent solution, but other interesting approaches, such as complementary filters, have been also proposed. Recent literature suggests that none of the state-of-the-art algorithms for sensor fusion consistently prevails under different applications. In fact, the orientation accuracy depends, besides the sensor fusion algorithms, on several factors, such as the sensor noise characteristics, the axis about which the rotation occurs, the type of movement analyzed, and the presence of ferromagnetic disturbances. These factors also explain the different, often contradictory results reported in the literature. For this reason, it is very important, prior to record data, to perform some spot checks or to minimize the sources of errors. Of course, this experimental setup was not very practical. Once the orientation of a technical frame is determined, the second challenge consists in identifying for each bone an anatomical frame. The latter operation is quite critical. The different solutions proposed can be grouped in 3 general categories. The functional approach is so called because the bone anatomy is derived from the joint function. For instance, being the hip joint a perfect spherical hinge, its center of rotation can be determined by recording the angular velocity of the femur with respect to the pelvis during hip joint calibration exercise. Similarly, since the knee joint has a dominant and well-defined degree of freedom, the mediolateral axis of the femur can be identified by the direction of the average angular velocity vector during flexion-extension motion of the knee. Being available the direction of the mediolateral femoral axis and the position of the geometrical center of the femoral head, an orthogonal frame can be determined. The main attractiveness of this approach lies in the fact that the subject can perform the calibration exercise by himself. However, differences in the execution of joint motions may influence the repeatability in the identification of the anatomical axis. A second approach consists in setting and exploiting joint constraints. For instance, the knee joint can be modeled as a four-bar linkage which has a single degree of freedom. As the relative motion between the unit attached to the thigh and the shank can be expressed as a single rotation about the axis which minimizes the various valgus and internal and external rotations. The advantage of this approach dwells on its simplicity. In fact, no calibration is required, but on the other hand, the 3D nature of the joint is disregarded. Furthermore, this approach can be applied only to joints with degrees of freedom less or equal to 2. The third and last approach consists in a direct identification of the bone anatomical landmarks. The anatomical frame of the body segment under analysis is identified via a specifically designed caliper. The device carries a unit aligned with the axis passing through the tips of the two pointers. By pointing the great trochanter and the lateral epicondyle, the longitudinal axis of the femur is identified with respect to the technical frame of the unit attached to the body. A second axis can be determined from the lateral and medial epicondyles, and the anatomical frame defined. The main advantage of this method is that the anatomical calibration only relies on the specific bone morphology. The disadvantage is that the calibration device is required and the procedures take some time. We have learned how it is possible to estimate joint kinematics. Let's face now the second problem, that is the determination of the 3D motion of a material point used as a global representation of the human body. In theory, the sensor position can be obtained by double integrating the acceleration signals once the gravity contribution is being removed. To remove the gravity, we need to know the unit orientation provided by the sensor fusion. And if the estimate of the orientation is not trivial, as we have seen, getting a reliable estimate of the position is even harder. In this respect, it is worthwhile giving you a rough idea of the effect of a gyro bias error delta omega on the position drift. Let's consider a unit still on the table. The constant gyro bias will cause a linear increase of the tilt error. The tilt error will imply that a small component of the gravity vector will be read as an apparent acceleration of the unit, and the integrated ones, it will result in apparent velocity. The second integration will cause a positional error growing with the cubic of time. For this reason, the problem of the position estimates can be solved only for very specific conditions. In human movement analysis, it is of great relevance the estimation of the foot or ankle trajectories during walking. Because gait is a pseudo-periodic motor task, it is possible to divide it into cycles, and by exploiting any instant of time where the velocity is known, to restrict the integration interval of time and hence the drift errors. The first step consists in detecting the initial and final foot contacts from the signals recorded by two units attached on the shank just over the ankle. Commonly, methods for gait events identification are based on analysis of the signals in both the time and frequency domain or on machine learning methods. This problem in normal gait can be considered solved. Much more is to develop a methodology which provides good results also for the analysis of patients with gait disorders. These videos show, next to physiological gait, three pathological gaits that can be associated to neurological conditions. On the top right corner, a patient with a coriform gait displays irregular, jerky, and involuntary movements. On the bottom left corner, the patient has a unilateral weakness on the affected side and drags her affected leg in a circumduction. On the bottom right corner, the patient has rigidity, walks with slow little steps and has difficulties initiating steps. Let's see how the orders reflect on the signals. As you can notice, different gates have differences in signal amplitudes and shape. Moreover, in coriform and hemiplegic gate, the patterns are less repeatable compared to physiological gait. If the gait event identification in healthy gait is straightforward, much more commitment is required to find a method which exhibited similar performance for both healthy and pathologic gait. For this purpose, we can exploit some invariant characteristics of the human gait. In fact, from a lower limb kinematics perspective, human walking requires that a. The lower limbs alternate their swing phase while the opposite foot is in contact with the ground. B. At some point in stance, there is at least one foot point fixed with respect to the ground. C. Swing begins with the rotor translation of the shank and ends with foot impact with the ground. Based on these considerations, from the angular velocity in the sagittal plane, we can identify the time intervals in which gait event can occur, thus reducing the size of the time intervals in which initial and final contacts have to be searched for. In these time intervals, the final contact is associated to a sudden rotor translation of the shank, whereas the initial contact with the foot impact with the ground. Once the gait has been split into cycles, the acceleration components can be rotated using the direction of progression, and then an optimal filtering and a direct and reverse integration is performed. Via further integration, the displacements are finally obtained. The same technique can be used to analyze the ankle trajectories during obstacle crossing with a very high accuracy, as you can notice from the graph, or to compute the trajectories of both ankles during gait. I want to conclude this talk showing as the methodologies which I described so far can be applied in contexts different from gait. This is my nephew, and probably is the youngest subject I ever recorded. Magnetosensing technology can help in this case to detect atypical motor development and to eventually define an early intervention. However, the current commercial systems are still too big and too rigid for this kind of applications, but we are quite confident that flexible and stretchable electronics will play an important role in the next years. The very last video is about my favorite sport, rock climbing. This climbing route starts with a very long jump move, and the climber has to reach the target hold with almost zero vertical velocity to be able to catch and hold it, as you can see from the same scene shot from a different angle. By placing a unit on the lower back, we can collect information about the trajectories of the center of mass, the power generated during the push-off, and we can understand the reasons behind a failure or a success. Thank you very much.